morning. My name is Zoran. Give you a little bit of background about myself. I reside in the United States in New Jersey. I'm a patient at Mayo Clinic in Minnesota in Rochester. I've been fighting prostate cancer, advanced prostate cancer, since 2015. About 8 years now. Went through a lot of the standard of care treatments, from initially surgery, then that didn't work out. Unfortunately, I had still PSA remaining after the surgery, meaning that it was advanced. Probably at diagnosis it was advanced. So then I went to chemotherapy, hormone therapy, that combination. And actually that worked relatively well. I was in remission for about 3 years. Unfortunately, after that, through PSA tests, my PSA started to rise slowly. Back to Mayo Clinic again, and we did some radiation therapy. I had some spots in my lymph nodes and the abdomen and a couple of other places. So basically I was back and forth. We'd find it, we'd catch it, we'd treat it, we'd catch it, we'd treat it. And finally that stopped working. So I guess around 2022, Lutetium came on the scene, but unfortunately I did not qualify for it in the United States. Medicare didn't cover it, and I also couldn't even get it because you pretty much had to be or exhaust every other treatment before you qualified for Lutetium in the States. So my doctor at Mayo suggested that if I wanted to go abroad to do it, and he suggested in Istanbul in Turkey. So I go, well, I don't know, I knew Istanbul because I've been here as a tourist before, but I said, wow, that's quite a trip, and especially getting treated. So, we explained everything, and he gave me a contact here, which is at Anadolu hospital here. And they hooked me up with an English-speaking coordinator, so any questions that I had, we were back and forth on email. That helped a lot because, there wasn't anything that they didn't explain to me. So I finally said, sure, why not? Let's give it a try. My other option was just to go back on standard of care, which is extensive hormone therapy, which I'm not crazy about. Anybody that's had it knows why. So I came last year. My first treatment here was, I believe, in July of 22. And the results were pretty good. It was pretty significant reduction in PSA. So we set up another one, and long story short, I had 3 infusions here. And everything was pretty good. The PSA went down for quite a while. It was, stable. But unfortunately, after about 4 or 5 months, it started rising again. Back to Mayo Clinic again. We did some more PET scanning, and we found a couple of spots. At that point, it was in my spine. We did some spot radiation. Again, the PSA would go down. Then, unfortunately, a few months it would go back up again. So we did that twice. Then now in 2023, again after localized spot treatment on my spine, my doctor at Mayo suggested we try another Lutetium treatment, 1 more infusion, or actually we did 2 this time, but with the addition of hormone therapy. that combination actually did very good for me back in 2015 when I did hormone therapy and chemotherapy. So I had the lutetium treatment in beginning of October, and everything was fine. You know, I mean, it's very well tolerated, by the way. I mean, I do feel fatigue. I think that's basically my only side effect. So I followed the PSA after the first infusion, and I had the hormone therapy prior to that, like 2 weeks prior. And it went down significantly. It was, you know, in the high single digits, and it went down to about half of that, around 4 something. And on Monday, this couple of days ago, I'm in the middle of my infusion, and my oncologist here, Dr. Kesban, who's wonderful, by the way, but that's another story. She comes running into the infusion room, you know, like a child, you know, holding this piece of paper. I go like, what's going on? She goes like, your PSA, it's under 0. I go like, what? I mean, she was more happier than I was, I think. So that's great. You know, basically under 0 means that it's undetectable. And that was prior to my second infusion. So I'm expecting like something like really nice, my next PSA test. So anyway, I've been asked here to do a little bit of like, you know, my experience here at Anadolu. And it's been very, very good. I mean, I have really no negative comments. The entire experience has been really pretty carefree. You know, it's, I was, like I mentioned, I was given an English-speaking coordinator that, you know, I communicate over email. And you ask any questions that you want, everything is explained to you, you know, in English, obviously. And then when the date is set up, you also communicate with your coordinator and you set up all your travel. I mean, you do, you know, purchase your own airline ticket. But as far as accommodations, as far as somebody waiting for you at the airport to drive you, you know, through a shuttle to your hotel, everything is arranged. I mean, it's like you have a relative here. It's pretty efficient and it's carefree. I mean, I don't really have to do anything. So you're also given, you know, a choice of where you want to stay. I stay here, locally here, because I don't have to take a shuttle. I can just walk over. So, but that's up to you. Another thing is the people here. It's a world-class institution. The people, the staff, the doctors, the translators, the guide, everything is first class. It's Western standard. The hospitality here is great. I don't know if you're not familiar with Turkey. I mean, they're very, very hospitable people. And it's a smooth thing. Now, of course, as far as the treatment, it's an individual thing. You know, a lot of people have, you know, good outcomes. Not everyone, unfortunately, but, you know, that's an individual thing. But if you're going to try lutetium, if you know, have that suggested by a physician, and you cannot get it in the United States if you do not qualify for it, I highly recommend Anadolu Hospital. Thank you.